Okay. So it's a pleasure to introduce Anna Gerometta, who is a lawyer, and she's very active in the social community, and she's going to speak about the interaction between scientists and the community, how to make them more impactful for less air pollution. Thank you, Anna.
Well, thank you, first of all, for inviting me. I feel a little bit out of place, but because I'm really going to bring down to the ground this very, very, very interesting conference. And I, again, thank you for Professor Mannucci for inviting me and for allowing us as an NGO to have a couple of days ago a citizens, let's say, dialogue with scientists outside of this conference. So, well, I would say that the goal of interaction between scientists and the community should achieve that the work of the scientists regarding air quality impacts on health is made visible, understandable, and correctly perceived by the public and policymakers. Every year, you scientists and researchers add crucial bricks to, oops, sorry, I think to the wall of knowledge and how to address health impacts with environmental problems that should and can be addressed properly by decision makers. And often these bricks can really show to the community the way to go. However, scientists have really little opportunities to make their finding visible to the public, and without such visibility, policymakers will not decide to tackle the problem. And this is really, I think, what Edoardo Croci was mentioning, and I think that it's probably the reason why we exist is to try to tackle your frustration, especially, I think, probably most Italian scientists' frustration, having made very great studies and seeing that they're not being really used. They're just being put in cupboards. So the years go by, really, and nothing really happens. This is January 2017, and this is Milan. Actually, I think that someone mentioned earlier, I arrived a little bit late, and I heard that it was mentioned that the NO2 average was 60 around, but I don't know what it was in 2016, but in 2015, which is the latest official data, the average of Milan was 73 of NO2, so it's quite higher. So, what, as we mentioned, and as Professor Dr. Harari yesterday mentioned to me, is where are the citizens? Because to enable this science to be really effective, we need citizens to be aware of it and to push for the science to come down on policies and become really, enforced and performed. And the reality is that, it was just mentioned, I think we really have an issue of communication. I assume that some European countries are probably more lucky because they have more sensitive, let's say, public, but I think that in Southern Europe and in Italy, we really need to put at least 10% of the researchers' time in trying to help communicating, because otherwise the message doesn't get to the people and the people don't push. So we as an NGO, we're let's say, made to try to bridge and perform, you know, a passage of knowledge from the scientists to the people. But of course, it's also difficult because we're very broke, and data are often a lot of data, and we need to really translate it, systemize it, and simplify the access so that the public can really use that data. I'm a lawyer, and for example, one of the things that happened to me many times is, you know, to describe in a very simple terms to judges why they should issue a certain judgment in favor of equality. And to do that, you know, it's hard to support your evidence with, you know, big complex data. You really need to simplify it and put it down to earth. And this is the same, obviously, and even more for ordinary citizens. If ordinary citizens don't have very simplified data, they will not be worried, they will not be sufficiently aware, they will not be in a position to use that data to write to their mayor or to go to their, you know, to the director of the school and say, hey, my school is in the wrong place, or, you know, you write to the mayor. So we really need to devote a tiny bit of the researchers' time to simplifying and support us or the people in communication. Okay, I with the authorization of Professor Sunier, I simplified one of the messages of his own presentation yesterday. You know, we need to get the people to have a very concrete perception of what the studies conclude. Children attending schools that are highly exposed to traffic have a 2 months reduced cognitive development over a year period compared to children attending a school not exposed to traffic. This is very concrete. And this, you know, it's something that every parent can get. And we just made a map of the 500 most polluted schools in Milan, and we will try to use this statement to convince children. Sorry, the parents. So, okay, this slide is a little bit weird, but you know, my feeling is that Zuckerberg just yesterday announced that he's going to make he bought a research engine to help the scientists to gather, you know, the most relevant scientific data to help scientists. Why don't we make a catalog on air quality impact with your data, trying to simplify, you know, the wonderful researches that you do for citizens? I know it's not easy, and I know that scientists don't like to simplify because simplification is dangerous sometimes, and I understand this, but we have to really make a step forward to understand that otherwise science is not as effective as it should be in terms of reaching, you know, policy makers. If people don't push, because they don't have, because they haven't understood the issue, they will not really push the policymakers, as Eduardo was saying before. So this is very important. So my first, let's say, suggestion is that maybe whenever you end and researchers end a research paper, I know that already environmentalists and scientists have let's say, the habit and, let's say, the prescription also to make policy recommendation. But I think that we should even go a step forward, trying to make, let's say, meaning of the study for the citizens in terms of, providing this research paper with an additional meaning, that it's not only policy making for scientists or for policymakers, but meaning for citizens to use. Just simple conclusions. So this, again, I think it would be very actually important to try to help us as NGOs actually to use these data that is very abundant and try to convey it to the public in a better way. In practical terms, it's not very easy, but we should try to make an effort. The other thing is, and that, of course, is not really a national effort, it's a European effort, because obviously, we're part of a group of European NGOs, and I know very well that we all face the same identical problems. In Poland, there's a very good doctor that, spreads the news, but from spreading the news of the new article on solid fuel combustion to having people in the houses understand that they should prefer to use a different kind of fuel to heat their own homes, there's a long way. So we really need to okay. So the other, so I think that, again, as Eduardo said, we need to make an effort of cooperating in disseminating the knowledge. And so probably each field of science can try to bring down to earth meanings, and maybe a big project could be to provide these tools in a simple way. One other suggestions, and in this way I think I'm sympathizing with your question before, is I think that in a way maybe we should try to decrease the use of discussing about premature deaths and increase the use of healthier lives. I think that we're seeing such an, at least in Europe, such a very long lives that the impression of dying at 88 and 10 months and 89 and 6 months, it's really makes really no difference to the public unless scientists want to engage in explaining very bluntly to the people that you simply, a noticeable portion of the premature deaths occur at 50 years old. Because that is, very practical, and then people would probably start to listen. But if we keep on talking about 10 months or 14 months earlier, I think it's not going to work. And, I think we should also emphasize the healthier life in a way that people understand what burden of that, sicknesses and I'm sorry, I'm missing the word, but if you develop a sickness, then we should try to make the people understand in a better way that actually out of air pollution exposure, you will be sick for a number of years and your quality of life will be really miserable. And so well, the other thing I wanted to say, and my suggestion, and of course I know so many researchers here who are just like this, we as NGOs and the citizens, but we as NGOs in particular, we need scientists to support us, giving us, let's say, the credit to show that we're doing it in good faith and we're backed by researchers. I'm just showing this is a project that we're just doing in these days, and we have the Chemical National Society supporting our project of NO2 passive diffuser monitors in Milan to engage people to measure NO2 in front of their house and in front of their schools. And of course, you know, having an important chemical society, Italian chemical society, allow us to present ourselves to policymakers as, you know, someone that is more credible. So don't back up when NGOs ask you to support them in a project, because it's important to be united and to show that, you know, it's a good way forward. Again, I mean, Francesco Forastiere and all the group from Rome know very well that I think that the press is very, very important. As someone mentioned, the lobbies are very, very strong, on diesel, on even on fossil fuels. Right now in Italy, for example, they will be publishing a new decree that will give stars of energy efficiency to fuel burning, small heaters in the house. And I'm very much afraid that this decree, which is, you know, apparently environmentally friendly, will become a major boomerang to enhance use of solid fuels, which is already increasing a lot in Italy, because there's a very strong lobby from the, you know, the heaters producers to try to sell their current heaters. So we must be, you know, Dr. Harari is always on the newspaper. I think he's perfectly right. We need to change the storytelling. I think in Italy in particular, I think we need to go simpler but in depth, which we very hardly do. I mean, journalists just, you know, give you very simple, you know, situation where peaks are going, but then it's finished. So I know from people that live in London that, you know, their effort and, you know, they've maybe caused, were let's say, one of the reasons why Sadiq Khan was elected was because air pollution was really one of the three major issues of London during the election, the electoral days. And they were saying, you know, we have to be on the press every day. So that was really their attempt. And the doctors said the same. So we need to be on the press. Okay, thank you very much.